The weather forecast with Akendugas.
Good evening, ladies and gentlemen, and glad to have you join me again on the weather forecast. I hope you had a very beautiful day. This evening, we may have a generally calm weather with moderate precipitation expected in some parts of the Adamawa, Littoral, and the southwest regions. We may have as low as 17 to 18 degrees in the west and northwest regions, with the center, east, and south as low as 21 degrees, and the north and far north regions expecting as low as 25 to 26 degrees. Detailing, we take you onto the Adamawa region where light showers will dominate the region tonight, and this will persist till morning except for the towns of Ngaoundéré and Minganga. Next, we carry on to the littoral where this evening there may be no chance of precipitation in the entire region, and by morning light showers may dominate the entire littoral region. Lastly, we take you to the southwest where this evening light showers may dominate the town of Mamfe, and by morning light showers may dominate the entire southwest region. To protect yourself and others against the coronavirus, wash your hands regularly with soap and clean water, sneeze with a flexed elbow. Any case of symptoms, call the number 1510. Have a good night.
Schools in the country may resume on June 1, 2020, at least for examination classes to ward off any eventuality of a no school year in the country. In spite of all the trials and triumphs in the northwest and southwest regions, the administrative authorities of the two restive regions have been on the front line, maintaining the territorial integrity of the nation at times at the risks of their own lives and perils. It may not be a Cameroonian originality, but mixed marriages are fast becoming a way of life in the country, which only go to consolidate the country for country's yearning for a much proactive dream of national unity together and national cohesion. Those are our top stories. Hello, everyone, and welcome to the 7:30 Bilingual News. I am Ben Meno Pufong. The Prime Minister, head of government, Joseph John Gute, today coordinated the weekly meeting of the Interministerial Committee to monitor government's response strategy against the novel coronavirus. The session, which took place via video conferences, focused on modalities for the resumption of schools in Cameroon and on the tentative date of June 1st. 2020. Participants deliberated on the school calendar as well as measures to be applied in schools to keep learners safe even when classes eventually resume. Details with Star Building correspondent Sisako Tamko.
Barely 16 days to the tentative date for the reopening of schools, members of government of the education sector are reviewing the possibility of schools resumption at all levels on June 1. As pointed out by Prime Minister John Gute, reopening of schools at all levels will depend on the evolution of the pandemic in the country. Meantime, the President of the Republic has approved the adjustments made at the 2019-20 academic calendar. In this respect, writing of examinations will be in July, August, everything being equal. Holidays could begin towards the end of August. Reopening of schools for the 2020-21 school year for basic and secondary education has been slated for October 5 and the 15th of October for higher education. The ministers of education were tasked to identify the classes that could start on that tentative date of June 1. Given the difficulties in maintaining social distancing in nursery education, the Minister of Basic Education was asked to identify the specific barrier measures to be put in place for this vulnerable group. Heads of the Education Department singularly gave an update on how they have been working for the school calendar to be operational. Public Health Minister, on his part, presented a report on the evolution of the pandemic in the country, which he says is under control. So far, 60% recoveries, 139 deaths, and 154 new reported cases Wednesday. 3 out of 587 passengers that arrived the country between Saturday to Tuesday were tested positive of COVID-19. He also elaborated on the material and financial contribution already received within the framework of the National Solidarity Fund put in place by the head of state to fight the coronavirus.
The latest development in the COVID-19 battle is the availability of rapid tests, which makes screening pretty easy. But affordability of this test is now the issue, as the government is shouldering the financial responsibility not just for the test but the treatment of COVID patients as well. So how is the government coping with this burden? Alice May took this worry to some experts and now puts together the following report.
Medical practitioners say the procedure to obtain COVID-19 test results is a difficult one.
These tests delay because samples are collected and are brought to us here at Centre Pasteur. We do the test for 4 to 6 hours to obtain the results, depending on the type of test. The management system here transfers the results directly to the emergency center at Mesa, where the results are handled secretly. The process is longer due to the number of results we handle per day.
Du nombre de tests qui doit être réalisé.
There is a need for patients to get their results rapidly in order to begin treatment early enough.
On est passé progressivement.
With the reinforcement of the 500 rapid test kits that delivers results in 15 minutes, as from next week, the population will see a change in the delivery of results. More workers will be employed, new communication systems through messaging will be installed to enable suspected cases know their results quickly, even at the district levels.
Il faut aussi prendre en compte la notion de confidentialité.
Even though the treatment of these patients is very expensive, according to the government, the state, in collaboration with the Ministry of Public Health, has put in place a decentralized procedure at the level of laboratories and different centers in each region.
Home remedies against coronavirus are popping up here and there as people strive as best as they know to keep the monster at bay. Traditional remedies sell like hotcake. When Cameroonians are not consulting at the herbalist, they are looking up for a recipe brandished as cure for the COVID-19 by some pharmacopist. Joyce Tata looks at the potions that are keeping many Cameroonians busy today.
In this kit, you have what we call ngulbetara. It's the strength of our ancestors.
Every day I receive many clients. I propose to them a mixture of aloe vera and some natural plants which I boil. They receive many clients daily, sure, but at what cost?
All of this will cost only 25,000.
I sell 1.5 liters of the drug like this one at 2,000 francs, which could be drunk many times.
And we recommend that the patient will go on the drug for 16 days. So you multiply 5,000 francs times the 4 bottles.
Some of these natural healers say given the fact that the virus took everyone by surprise, they hardly hesitate in administering their drugs, as saving lives to them is more important than gaining.
As a patriotic Cameroonian, we have given this treatment to 2 patients free of charge.
The current health challenge has caused many Cameroonians to seek refuge in traditional medicine, hoping they could be saved from the pandemic ravaging lives today.
A health concern in Douala, which reportedly charged exorbitant bills for COVID-19 patients, has been sealed by the senior divisional officer for Vuri Division. Polyclinic Mario's recalcitrant behavior was reported to the Minister of Public Health, who ordered the closure. It is reported that the clinic is notorious for exaggerated health bills to its patients, as Alphonse Abongwana reports from Douala.
The sledgehammer of the law finally falls on the presumed defaulter, Polyclinic Mario. The latest scandal of the health structure dates back to May 11. After a patient died in the hospital, his family and the health structure disagreed over the cause of the septuagenarian's demise. To the hospital, this patient had COVID-19, but his family said their patient was a long-time victim of hypertension. The hospital was reticent to return the deceased to his family on grounds of rules related to the coronavirus pandemic. pandemic. This resulted in an unhealthy exchange between both parties. The family had paid bills to the tune of over 1 million CFA francs. In a second case, a bill of over 14 million CFA francs issued by the same health facility to one of its patients has been circulating lately on social media. And on the last count, another bill of 6 million CFA francs, still by the same structure to yet another patient, got to the ears of the Minister of Public Health, who requested for explanations from officials of the structure but got no answer. These successive events account for the temporal closure of the clinic by the administration on instructions of the public health boss. To the minister, the clinic does not have the authorization to cater for COVID-19 cases. After sealing the doors, warning signals have been sent to other private hospitals caught in the same dragnet. Meantime, patients who were admitted in the hospital have been evacuated to other health facilities in Douala.
Over 18,000 protective face masks and other sanitary kits will be distributed to some inmates of 5 regions of the country to curb the spread of the dreaded COVID-19 pandemic. The sanitary equipment were handed to the Vice President of the National Commission on Human Rights and Freedoms today by the Deputy Representative of the United Nations Development Programme to Cameroon, Alassane Ba. We have details with Romeo Nkenye.
Symbolic handing over of hygienic kits to be distributed to inmates in 6 prisons of 5 regions of the country. The initiative has been nurtured by the United Nations Development Programme.
Prevention and fighting of COVID-19 in prison in Yaoundé, Balmayo, Marwa, Buya, Bamenda.
The move is sustained by the National Commission on Human Rights and Freedom and the National Youth Council.
It's timely because you know that with this coronavirus pandemic, there's no treatment.
These items that will be received in the different prisons be kind of a response to help those vulnerable young people that are into these prisons.
It is the wish of donors to extend the gesture to other incarceration centers in the nearest future.
Zoetele in the Jar and Lobo Division of the South region has also received the Head of State's anti-COVID-19 package. The beneficiary population turned out to receive their share from the visiting senior divisional officer of the division. Ewane Epole was there and now tells us more.
The presidential package of COVID-19 preventive kits has come to boost the efforts of the local population of Zoetele in fighting against the deadly pandemic. The consignment comprised cartons of laundry soap, hand-washing cans, cartons of hand sanitizers, and face masks. The senior divisional officer of Jar and Lobo, David Kulbut Aman, who chaired the handing over ceremony, exhorted the people to use the material judiciously. The representative of the locals of Zoetele lauded President Paul Biya's goodwill gesture. It's worth noting that as of Wednesday, May 13, 2020, the municipality of Zoetele has not yet recorded a coronavirus case. The people are poised to ensure that the subdivision remains free from the ravaging disease.
In turn, such the Disarmament, Mobilization and Reintegration Center in Boya have been armed with COVID-19 hygiene kits as well. They have been told by the donors from the 21st Motorized Infantry Battalion that their war now will be against the coronavirus and nothing else. Annabelle Ndike Enonyang reports from Boya.
The Disarmament, Demobilization and Reintegration Center in Boya welcomed the divisional officer and the military commander of the 21st Motorized Infantry Brigade, emulating the footsteps of President Biya to fight the spread of COVID-19. The colonel says the gesture is vital.
The main concern of our action is to fight versus COVID-19. And I see the occasion to to invite all my young brothers and children who still live in bush to drop their arms and join this center.
The regional coordinator of the DDR Center, Bernard Fojo, while receiving the gift, expressed gratitude to the colonel and says the items will go a long way to improve on the feeding habits of the inmates as well as to fight the prevailing pandemic. The divisional officer for Boya, on his part, encouraged the ex-combatant to be disciplined and useful citizens in your various activities in order to be better Cameroonians.
Let's now take you to the far north region where the COVID-19 fight is also led in Dukula, a village in the Mayo Danai division of that part of the country. CPDM Member of Parliament Celestine Tabuli donated hygiene kits to the villagers to help in this battle. We have details with Joseph Anyankaina from CRTV Far North.
CPDM parliamentarian for the Mayo Danai South constituency has been described by the beneficiaries as life-saving materials, which will go a long way to stop the propagation of the coronavirus in the locality.
We are very happy with these gifts because it will really help our population fight COVID-19.
For the benefactor, the fight against the pandemic needs the contribution of all.
We have to sensitize our population, so I give them the logistic to accompany them to observe those measures.
Chairing the ceremony, the divisional officer of Karhai subdivision urged the population to continue respecting government measures to stop the spread of the virus.
I want them to make good use of this material and to continue to foster the efforts by bringing each and everyone what he can to the population.
All speakers who took the floor during the ceremony were emphatic on the need for the population to observe basic hygiene rules.
This is the 7:30 news, and we are beaming live on the Cameroon Radio Television Corporation, the CRTV, right here from Yaoundé. And we open our special package on the 20th May celebration, National Day celebrations of Cameroon. Cameroon's unity has come under attack in recent years due to the socio-political crisis in the northwest and southwest regions, but the willingness of the countrymen to stick together has been stronger, reason why the country has stayed in one piece. The contribution of administrative authorities in preserving this unity has been remarkable. At a time when administrative authorities were targets of secessionist forces, many of these senior divisional officers and DOs showed resilience, drawing the admiration from all and sundry. Ola Titaki reports and puts in Ola Titaki reports about the contribution of the administrators in keeping Cameroon up and floating.
The once buoyant northwest region is now a mere shadow of itself as a result of the socio-political upheavals affecting the region for close to 4 years now, while some civil servants have abandoned their duty post for fear of being killed or kidnapped in exchange of huge amounts of ransom. This has not only hampered development but hinders the smooth functioning of administrative authorities.
We are here, our daily work is to protect the population here in Mezam Division and their property.
Amongst the most affected areas are Boyo and Bui divisions. Despite the upheavals, the various administrative authorities are bent on defending the fatherland and the population under their command.
With the actions which we are deploying, in spite of the some other currents of insecurity which still abound in our territory, we hope that with no time the social mobilization shall record a marked improvement in peace and calm in Jakiri subdivision.
Administrative authorities in the 7 divisions of the Northwest region are thereby urging their population to collaborate with the forces of law and order to fish out the separatist fighters in order for the reconstruction plan by government to be carried out smoothly.
The Unity Palace of Cameroon, that is the presidential palace, is one of the symbols of national unity where all Cameroonians converge to celebrate their living together at the traditional May 20 banquet. Constructed with architectural touch of a French Tunisian, the futuristic monument was inaugurated in August 1982, hours before the celebration of the 20th of May event of that year. Charles Ebune now reports on the Unity Palace as an edifice that epitomizes the now vaunted slogan of national unity in Cameroon.
Constitutionally, this is Cameroon, the touchable human symbol of this country's unity, housed inside the nation's most assembling architectural outfit for oneness, the Unity Palace. A palace for unity first used for a National Day banquet celebration 37 years ago. It was inaugurated same time length within the National Day week after the inauguration of the Yaoundé Conference Center in 1982. This is where the plus 250 ethnic compositions of the roughly 25 million souls from the 360 councils democratically meet to hail their unity in diversity with a mosaic of identities from the 4 cultural zones they attire speak. The Unity Palace is a summary of the Cameroonian institutions where the president takes all the major national decisions on national unity being the most precious. As an office of 3 floors located to the neighborhood in Yaoundé, the most salient of top-profile visits come here in the likes of popes, kings, president, the most eminences, the diplomatic class, and illustrious sons and daughters of the country are honored here, the likes of the national football team. A complex imposing on one of the 7 hills of Yaoundé, the Unity Palace is one of Cameroon's best architectural jewels, normal because it bears the prestige of the Cameroonian people. Although a banquet here will be absent this year for National Day celebration because of the coronavirus sanitary challenge, it remains the Unity Palace.
And the story of the birth of the Unity State in Cameroon is like a goatskin bag with everybody carrying its own. It happened under well-known circumstances despite some looming controversies among historians on its veritable underpinnings. There are living witnesses to that event like Professor Dorothy Njema, who was at the time a lecturer in the then Federal University of Cameroon. Olivia Mbaye sat down with her to take notes on her own account of the unification story as she saw and lived it. And she pieced together the following report from Boya.
In 1972, Professor Dorothy Njema was a lecturer at the then Federal University of Cameroon in Yaoundé when discussions on the unitary state were brought to the table.
I was at home in Yaoundé. We had heard that the president was going to be at the assembly, and so we were listening. I voted for the United Republic of Cameroon.
To this one-time Vice Minister of National Education and pioneer Vice Chancellor of the University of Boya, the transition from a federal to a unitary state was motivated by several factors.
It was very expensive to run East Cameroon, West Cameroon, and the federal government. The West Cameroon government always had a lot of difficulty in meeting the commitments of its budget.
48 years down the road, the country has had its high and low moments. Professor Dorothy Limunganjoma says even if time was to be rewound, she will still vote for a one and indivisible Cameroon, but calls for effective decentralization.
Over the years, people have had second thoughts about whether it is the best arrangement to have an over-centralized system. But I'm not sure that the way that some people have gone about it is the best. I would go more for an effectively decentralized system.
Although this year's National Day will be void of the usual public celebrations, she has urged Cameroonians to forge on in love and solidarity despite the current challenges.
Let's take a break now from national unity and go over to the National Emergency Coordination Center of the Ministry of Public Health to talk about updates on the coronavirus. And our reporter posted out there is Clarice Array Takang. Now, Clarice, tell us, we hear that there have been 19 new recoveries in Cameroon. Sounds like things are moving in the right direction.
That is quite correct, Ben. 14 COVID-19 patients recovered from the dreaded disease today, and that brings the total number of recoveries in Cameroon to 1,569. Good evening and welcome to the Public Health Emergency Operations Center, where it's been a very busy day for the staff here at the call center. We were already informed that they had 5,300 calls from different parts of the country, from different people who are very concerned about the prevailing situation. And it's not yet 8 p.m. So since 7 a.m. this morning up to this moment as we speak, the call center has registered some 5,300 calls, and the number is going to increase. And that tells you how concerned many people are about the public health pandemic that has not spared Cameroon. And of course, because of that, Ben, we took interest in voluntary screening. Who can decide to get tested? Who can decide to go for screening for COVID-19? And we were told here at the call center that it's not just about going to a hospital and declaring that you have symptoms of COVID-19. You have a dry cough, you've been sneezing, you have a fever. What is recommended is that you call 1510. And when you get through to the call center, you will be received, and you have to go through a question and answer session. You will be asked different questions, such as, do you have any underlying health conditions, the symptoms you have been showing, and of course your age, where you live. And depending on the answers that you are going to give, that will determine if you would be sent for screening or not, or if you need taking care of. And it's been very busy here at the center. And another thing that we took interest in is who can go for screening. Not everybody just gets up and goes to the hospital and says, I want to get tested for COVID-19. No. And we've been told, even if you get to the hospital and you're received by a doctor and you explain all the symptoms you've been manifesting, if it turns out to be that there are symptoms of COVID-19, you will still have to go through 1510, because the medic is required to call 1510, and you will be put through. And like we told you from the beginning, it's 14 recoveries today, and that brings the total number of recoveries in Cameroon to 1,569. It's good news for the health staff. It's equally good news for the different families concerned. But of course, vigilance remains a must. The population have been told they have to keep observing basic hygiene rules. They have to keep wearing their masks when they go out in public. They have to keep making sure that they observe social distancing measures. Ben, back to you in the studio.
Thank you very much, Clarice Array Takang. And I corrected with you. I announced 19 cases of recovery from the outset, but you say 14 cases have already been recovering today, bringing the total number to 1,559. Thank you for those updates, and we'll be getting back to you in a subsequent newscast. Let's go back to our talk on national unity to say love knows no boundaries as it transcends ethnic groups and becomes even sweeter when there is a fusion between people of two different tribes according to couples in inter-ethnic marriages. This is indeed the real-life story of some couples in Cameroon where there are about 250 ethnic groups making the country rich culturally to so diverse. Just how harmoniously do such couples live even though having different cultures and vernaculars? Yoti Kalilisonge has been prying into that story.
Crazy in love, they definitely are, yet from different tribes.
Tribal marriage for me is not a problem. It all depends on the way the couples they take it.
I grew up having a passion to eat eru, but I'm from the Northwest, and what we eat in Northwest is PATYCHOU. So it so happened that the woman I fell in love with, coming from Bayangi, and their native meal is actually eru.
It is the Cameroon way of life, and it is lit.
I call her my human eru. Because it's like the eru which I became so passionate about. Finally, I got a wife who is going to be cooking me that eru. Not just because of the eru, but it's one of the things that spice intercultural marriage. From where I come from is PATYCHOU we ate. And then it was so surprising to know that the best meal of my wife also was PATYCHOU. So
the Ebiles, married for about 8 years now, aren't the only ones who tell a lovely tale. Meet Mama Bernadette, a Bassa from the Center region, who, though in legal union with a Betty from her region of origin for the past 35 years, has braved their differences.
I accepted him for who he is, and vice versa.
Then you also have this Bajoi man, married to a buyer, both from the East region.
Being diverse is an advantage. We are trying to unite it to form one.
We speak Beti, Bassa, and French.
For these couples, transcending tribal boundaries is worth a try.
There's a beauty in intercultural relationship because there are some expositions which people from different culture have that can actually inspire you to be more creative and more productive.
With Cameroon counting some 250 ethnic groups, living together is a reality amidst the different backgrounds and beliefs.
And it's on that happy note that we end it on this edition of the 7:30 News. But before we go, a recap of our top stories. The Cameroon government has intimated that schools in the country may